Hi guys, welcome back to another video. Today we're talking about twin-to-twin transfusion syndrome. So twin-to-twin transfusion syndrome occurs when the mother is pregnant, and when she's pregnant she has twins, but then when she has twins they find out she has only one single chorion. And then basically the biggest complication is that the babies can present with heart failure and eventually they can die, and that's obviously a big thing. One quick thing you'll see is that the baby here, or both babies, are sharing a placenta. This is the placenta right here, okay? And in purple right here, they both have their own amniotic sacs. So this is considered a monochorionic diamniotic. Okay. That's how it is. So this is monochorionic diamniotic. And so basically you have to understand why does twin-to-twin transfusion occur, and what causes this oligohydramnios and then the polyhydramnios, and we'll see other symptoms as well. First of all, that you have to one thing that you'll be tested on is that this is just something that you're going to see, or that will be presented in the UWorld questions. They're going to say there's an intertwined membrane that meets the placenta at 90-degree angle. It's a T sign. If they ever show you that, that's always going to be a twin-to-twin transfusion syndrome. And you can see over here, this kind of presents with a T sign right here, and it usually that the placenta should have, my drawing is bad, but the placenta should have been like that. But you can understand what I'm saying. So what's the problem here? The problem here is basically this. So this side is going to present as the donor, and this side is going to be the recipient side. Okay. So donor for this is the blood vessels for the donor twin, and this is the blood vessels for the recipient twin. So what happens is basically you have an unbalance in the blood flow, and basically the baby that's the recipient is getting a lot more blood flow, and through the anastomosis. Okay, so like I say over here, you can read it right here. Blood from the placental arteries, and remember the ones that are arteries because it's deoxygenated here. So the arteries are high resistance pressure of the donor twin, so it's going to come downward, and then it's going to be shared. So it comes downward and it becomes shared with the recipients, and the recipient receives all that blood and brings it back up. And that's why you're going to see some things in some of the findings in the donor and versus the recipient baby. So first of all, the donor twin can present with renal failure, oligohydramnios, low output heart failure, and fetal growth restrictions. And you can see that my ugly drawing here, the baby is very small. You know, you have oligohydramnios, and you can consider, the baby now having renal fail or having fetal growth restrictions as well. Remember that you have other. Remember, because the patient doesn't have, or the baby doesn't have enough amniotic fluid, mom's body is going to start compressing the baby, and it's going to cause the baby to not grow properly. And so then we look at the baby who is the recipient, and that patient will have polycythemia, polyhydramnios, cardiomegaly, and high output heart failure with hydrops fetalis. And you can see I drew the baby a little reddish, and he's a bigger baby, has a lot more amniotic fluid, and this is its own amniotic sac. And let's see, so that's basically the big thing here. They're both, like I said before, are at risk for intrauterine and neonatal death, and that's why this is so important. So if the patient has mild twin-to-twin transfusion syndrome, you're just going to do serial ultrasounds to make sure the patient's baby is not getting any worse. But if it becomes moderate to severe, you're going to do laser coagulation of the placental anastomosis. I hope that helps. I know it's a lot of a lot of drawings and a lot of different pens, but yeah, that's twin-to-twin transfusion syndrome. So got this straight out of your world. Hopefully it helps on your step 2 exam. Take care, guys.